Hello, this is a re-recording of the information given by the Virginia Department of Health at the Tidewater Air Monitoring Evaluation meetings held on October 17th and October 18th, 2022.
Hi, this is Dr. Dwight Flammia with the Virginia Department of Health. I'm the state public health toxicologist. Next slide. So the role of the health department in evaluating exposures or sites such as what is being monitored by DEQ is to answer some of these questions, which are what are the health concerns? Are there any health concerns with what the community may be exposed to? Is there an exposure? And the reason for that is, when we look at health assessment, we try to answer the question, there may be something that's toxic in the environment, but it may be something that you're not actually going to be exposed to. For example, if there's lead in the soil may be underneath a parking lot, so therefore there is no exposure. So these are some of the things that we help address. And then if there is any exposure, is there an impact to health? For example, just because there's a chemical or a contaminant in the environment, it may not be at a level of concern or even impact individuals in a way that may cause harm. For example, some chemicals, how they enter the body, whether it's through dermal or touch, or through inhalation or ingestion, may or may not impact the individual. And then what we do is we also help with working with DEQ and determine what are the potential actions or things that could be due to either remove or lessen any impact to public health from these contaminants that are identified in the environment. Next slide. So what's the role of the toxicologist in the health assessment? We provide assistance to environmental agencies such as Department of Environmental Quality, local health departments, and also our federal partners. We develop assessments to identify any possible actions, such as which steps should be looked at, or how we can work with DEQ or with the community, whether it's helping to identify ways of lessening the impact or removing the impact, or even just providing health education to concerned citizens if we identify that there isn't an impact to health. We provide health advice to the affected communities, whether it's through working with the local health department or written health assessments, or one-on-one communications with individuals. And we help provide a framework for public health interventions and research. If there is anything, for example, if there's identified contaminant in, going back to the soil example with lead, working with our local health departments or environmental partners and helping determine what interventions or research, such as collecting additional samples, maybe from a playground versus individuals' yards, or maybe even determining if there's a need to have any blood lead levels testing done. Next slide. And so what are some of the information that we use? Well, we do site visits, which is where we'll actually go out into the community, meet with individuals, do a tour, see where the contaminants may or may not be released, if they're actually in the environment. For example, going back to the soil under the parking lot, that's a site visit which may end up with, hey, there is lead in the environment. However, there's no exposure. So that may be part of our assessment and help us with determining if there are any future routes of exposure or any additional work that's done. Depending on the contaminants, we use the environmental sampling data that DEQ provides us. We can look at health outcome data, which could be things such as hospital records, medical records, or live birth data, or even morbidity, mortality reports, or death reports. And then we do exposure investigations, look at those if there are any exposure investigation results, such as I was going back to the lead result. And then we'll use what the community knows, because a lot of communities, through the use of the internet and working with local and other partners, are already well versed and know what impacts there are to their community, and are able to use the internet and libraries and other resources to determine what health hazards go hand in hand with particular contaminants. So we don't want to keep, regurgitating stuff that the community already knows. We want to provide them new stuff that can be helpful, and also find out what their concerns are and make sure that we're addressing what they would like to know. And then again, that was like I said, with health concerns and community. Next slide. And so there's generally a health assessment can be broken down into 3 steps. Where you identify and evaluate the exposure pathways, such as I mentioned earlier. You want to first know, you know, is the route of exposure from inhalation, which it would be for air contaminants, of course. Then the next step is compare environmental data to health-based screening values. And what we do with this is a lot of our federal partners, environmental and health partners, such as those that work with the CDC or the Centers for Disease Control or Prevention, have developed numbers that we can use to evaluate a large number of data in the environment. So if the Department of Environmental Quality is looking at a number of different metals in your community and air, what we do is we can quickly scan those and determine if any are a concern. And what is done is we compare those to what are called screening values. A screening value is essentially based off of either animal data or human data, where a number is found that this may or may not impact either the animal model or the human model. So let's use the animal model. So most data is done based off of animal models, and the reason for that is we don't promote going around testing humans. So if you take the animal model and you find a concentration in the air that doesn't affect the animal, then what we do is we'll take and actually make that number 100-fold lower. So it's 100 times more protective. And if we screen and we find out that what's in the air that our Department of Environmental Quality found, and it's well below that, then we know that there's no reason to be concerned. However, if the number is above that screening value, it doesn't necessarily mean that there's going to be a health impact. What we then do is we'll actually calculate a community-specific exposure dose, or at least an estimate. And the reason for that is because depending on a number of things, the exposure to children, they have different body weights, are going to be different compared to an adult. There's also a difference between workers. Workers are generally perceived as being healthy individuals. They also have different schedules. So somebody working in an environment where there's a contaminant is only going to be there for 8 hours a day, versus somebody who actually lives there, maybe somebody who's retired or an elderly person, or even somebody who's, a child. Their exposure is going to be different. So what we do is we'll actually do an exposure dose calculations for those specific populations, or we can just do a general one. Next slide. So that what would be provided in the health assessment, what's done is what we mentioned, the exposure assessment, B, the toxicological assessment, which is essentially how toxic are these chemicals, how are people exposed to them, and how they interact with the person. For example, it may have a toxic response if you inhale it, but not necessarily if you're touching it or if you ingest it. Then we review any health outcome data, which again is looking at birth certificates, looking at hospital records, looking at death reports, and then the health assessment will also provide conclusions and then recommendations, which could be very well make this report available to the community. The report a lot of times has a lot of health education material in it, so it could be simply just recommending that we share that. And then again, we will work with our Department of Environmental Quality to determine if, how we can help them, or, discuss, what we would like to see as far as, protecting public health.